This graph shows what happens to our blood glucose levels after eating a meal. On the x-axis, we have the time after eating the meal in hours, and on the y-axis, we have the amount of glucose in our blood, or our blood glucose. It's in milligrams of glucose per 100 milliliters of blood. This dashed line shows where we would like our blood glucose levels to be. When we eat and digest a meal, our blood glucose immediately increases. Also shown here, this is the bloodstream, and there's 2 units of glucose as an example, and after eating a meal, the amount of glucose in our blood immediately increases. When this happens, our body wants to return our blood glucose to a normal level. So, our pancreas releases the hormone insulin into the bloodstream. Insulin tells our muscle, liver, and fat cells to take up glucose from the bloodstream. These cells then store the glucose as glycogen. After the cells respond to insulin and take up and store glucose, our blood glucose levels drop below the normal level a few hours after a meal. Again, we want our blood glucose level to be normal. Therefore, now our pancreas secretes the hormone glucagon. Glucagon tells our liver to break down glycogen into glucose and release it into our blood. Finally, our blood glucose levels are back to normal.